Now, the strike embarked upon by the National Association of Resident Doctors is in its third week, and it is indeed biting hard, leaving many patients with very few options. Despite the order of the National Industrial Court for the striking doctors to suspend hostilities till September the 15th and resume work immediately, they have refused to shift grounds. Minister of Labour and Employment Ngige described the court ruling as a welcome development. He reassured the affected doctors that the ruling would not prevent the implementation of agreements contained in the Memorandum of Understanding reached at the last meeting with the Nigerian Medical Association and affiliate associations with timelines affixed to them. The NMA had led 3 doctor associations to the negotiation that lasted several hours last Friday, after a series of negotiations between the government and the doctors failed. Strategy consultant Dikbo Oyewale and social commentator Smart Akwejoye are in the studio to discuss this. Gentlemen, good morning. Thank you for joining us on TVC Breakfast.
Good morning, Veronica.
Now, let's make a sense of what is going on between the federal government and the doctors. We see that this issue started sometime early this month in August, and there was back and forth to the extent the federal government had to drag the National Association of Resident Doctors to the Industrial Court, which generated a lot of reactions from some quarters. And eventually, the federal government signed a memorandum of understanding with the NMA, not the resident doctors, although it's the umbrella body. But then some are saying that the government's handling of this matter is some sort of high-handed for some persons, and that government should have sat to reason with the doctors in terms of looking at the agreement, because you came up with another agreement and the doctors are saying take action before we get back to work. But then let's make a sense of how you feel about the back and forth with the federal government.
Well, I believe that what we say today in terms of the strike with the doctors and the issue with the government is symptomatic of what we see in government today. This is what I mean. So far, what we've seen in government today is people in places of authority that see it as an us versus them game. And when you approach things from that perspective, when it comes to deal making, you do not show utmost regard for the other party. Now, you reached an agreement. If for any reason whatsoever you were not able to fulfill that agreement, you just common courtesy that you call the other party and say that, come, these are the issues. I know we agreed on this. The timeline was 3 months. Can you give us another additional 3 months to have this done? But that is not what we see. We see people in places of authority talk to other folks that are not on the same side of the aisle as they are with so much disrespect, with threats. I mean, that's not how to make deals. It's very simple. You're negotiating. Compromises will be made on both sides. I mean, I don't think the doctors are being unreasonable saying that you need to get this done before we go back to work. You also have to note that there's been a lot of trust deficit between the government and the doctors and also other associations in the country. Historically, we keep having this conversation practically almost every year. So the question is, what is the issue exactly? Why is the government finding it hard to execute or implement whatever it is in the MOU they signed with the doctors? So there isn't so much trust. So you saying that the doctors should go back to work, that we will get back to it, is something they have been hearing year in, year out. So I don't believe they're going to do that. But I also believe that it's quite irresponsible, if I may use that word, that at a time like this, because we're still in the middle of a pandemic, whether we like it or not, that the government is still dragging their feet with issues that surround our health. So I think for me, that in itself is quite questionable, and they should really, really look into what their priorities are.
Do you think it was right for the NMA to have appended its signature to that agreement, saying that the situation with the resident doctors is something that has been going on? It can't, the body cannot say it is not aware with what is going on. Have they sat to engage with the resident doctors and government? Because when I spoke with one of the resident doctors, the senior members of that association yesterday, he said that they were just invited to the meeting as an onlooker. So they really were not informed about what was going to happen. They just came in there.
So which is part of the challenge, not understanding the fact that when you want to have conversations like this around negotiations, all the parties involved must have a say in it, not just having some people talking and then some people having to be onlookers when they are actual stakeholders, because in the end they are the ones that are actually in the heat of it all. So for me, I think it is quite embarrassing, really. It is quite embarrassing, and they need to relook and rethink how they go about negotiations and execution of those negotiations.
Let me come to you, Smart, at this point. Yesterday, we saw a video where a lot of doctors went for an interview somewhere in Abuja, where there was an interview by an agency from Saudi Arabia, and people, you know, were beginning to say that, see what is going on. Saudi Arabia is coming to take a lot of our doctors. And before now, there's been the issue of brain drain in that aspect when it comes to the issue of healthcare. And then we see how government is managing this issue. What kind of signal is it given to doctors, especially those who are even thinking of practicing within the country as it is?
Veronica, thank you once again for having me. It is sad again that once again we have to discuss one of the failure of this government. No matter how you look at it, the underlying factor in the strike is funding. Either funding in terms of human resources or funding in terms of medical equipment. Yeah. That is the underlying factor. So when we take it from this aspect, does government have the fund going by the budget to meet all what they are saying? No is the answer. Now, you now begin to ask, what is the alternative? Have there been an alternative that the government refused or failed to look at critically? And I would say yes. You now begin to look at that aspect of the National Health Insurance Scheme. You see, I like benchmarking a lot because that is the only way you can have a credible result. I probably want to benchmark our health system vis-a-vis our colonial masters, the United Kingdom. Today, in United Kingdom, the National Health Insurance is the major employer. But when you look at it today, vis-a-vis Nigeria, when you look at it, are we supposed to be doing better? Honestly, sometimes I wonder, I sit down and wonder if we even have a government that have empathy for the people. And I come up convincing myself that it is sad that we have this kind of government in place, because already there is this National Health Insurance scheme. Today, the federal government shouldn't have been talking about even budgeting if adequately they have followed it religiously. Because you see, let's assume the three of us take up health insurance. It's not likely that the three of us will fall sick at the same time. Yeah. So that means there will be, so if one of us falls sick now, so that means there is an adequate funding to take care of that person. So let us follow that line. That line has not been properly followed. And now begin to look at, no matter what we say today, I keep giving credit to Obasanjo when it comes to some aspects. This is one aspect that Obasanjo did very well. When he came up with the National Health Insurance, we were expecting that virtually all Nigerians, even up to the artisans, up to the artisans will be captured in this. And if they are captured in this in the first place, the government are not supposed to be players, they are supposed to be regulators. Right. In this. Are they doing it? They are not. So sometimes you now begin to wonder again that I think something will happen drastically that will make these people sit right, because I cannot just imagine.
What else can happen? We are in a pandemic.
I cannot imagine that
outbreak. Yes. People are dying.
I cannot imagine that anytime I look at this Ngige, I felt it is sad for them bringing such a guy as the minister. Doctor, actually. And beside again, yes, you see, he's even a medical doctor. And again, you cannot even put him there again, because in the first place, that is not even his area of core competence. Perhaps so, but then I don't want to talk about Ngige's failure, because when you look at most of the time when he talks, you begin to look at it. Does this man even went to school at all? Passed through school. Now you now begin to ask again. We have enough funding to face education, to face health, if we have gone with the health insurance. If we have gone with the health insurance, I'm telling you, our health budget will be in trillion. That is the simple truth. The less than 400 billion that is voted on health cannot do anything. And again, you see, and I talk from a vantage position because I take it upon myself to visit some of these places, like the health center, primary health centers, is virtually not existing.
Yes.
Absolutely.
And when these are not existing, these are the fault of the local governments. Are the local governments responsible to responsible to their responsibility? No, in that aspect. Now, when you come to the general hospital, which is that of the federal state government, I was at the general hospital throughout on Monday because we lost somebody very close in the parliamentary circle. I was weeping throughout on Monday. Ikodu General Hospital precisely. Now, when you look at Ikodu General Hospital, they only have one consultant to attend to over 700. And you now begin to look at even the payment system is wrong. Are these present?
More of those doctors will be leaving.
Yes.
Now you now begin to look at it even that, honestly.
Perhaps we do not understand the situation on our hands.
Again, yesterday again, as I was about going to bed again, somebody sent me a video of doctors queuing for an interview, document verification, in a popular hotel in Abuja.
The agency
is a Saudi Arabia agency in collaboration with a Nigerian agency in the first place. And now they now even interviewed a sister television house, interviewed some of the participants. A lady said, look, even my own lecturer is even that she saw her there. She saw the person even wanting to migrate now to Saudi Arabia. That says you the failure of a government. You see, it is not because anybody wants to run the government down, but you see, the government have to be told the truth. They have failed in the health system. All these shenanigans that Ngige is displaying, honestly, it should not. They should even be on their knees begging these people. So, because in the first place, if you're asking me that if you are beating a child and you're asking that child not to cry, then you are unjust. Have you given these people the adequate resources to work with in terms of equipment? No. At this time and age, you still find that even a government hospital will refer you to a laboratory outside government hospital to go in a private to go and carry a test and bring the result. At this present time, we still talk about carrying files, medical files.
Right.
Where in hospitals abroad, it passed through the system. Just they'll take your table, they'll enter into the system. You can go and see the next person. That they have it even right from your DNA. They have all of your medical record in a single system. That at every point in time, your blood system, your whatever, they can always tell you what to administer. This is a failure of a government.
That's the word that the National Association of Resident Doctors have said, that they feel they are being punished for the government's failure. That was why they didn't append their signature to the MOU, and that there was a clause. And when I asked the one of them yesterday, he said the clause was a no work, no pay clause, which was not explained.
Yes.
And this whole picture, is it that we are not really understanding the situation on our hands? I mean, you every day we see the figures coming out of COVID-19, the number of deaths, complications.
Now we have cholera on our hands.
And now we have cholera on our hands, and then we see doctors who are ready to jet out of the country. Yet we are responding to the situation like this. If something is not done as quickly as possible, what do you think would happen? What picture can you see for our healthcare sector?
Well, typically, this is what we'll see in sequence. So this is how the Nigerian government works. There's an issue. We will not address it on time. We'll let it degrade into the place where it's practically derelict, and then we start to declare state of emergency. And then we start to vote a lot of money towards it. And then we end up not seeing any results whatsoever. Unfortunately, that's a cycle that we've had over and over again, and I think it is time that it is stopped. However, I would also say this, that I am not quite surprised that we're seeing this in our health system. This is why. You would agree with me that even at the highest levels of government, people in authority, either elected or appointed office, have no buy-in in terms of our public healthcare system because they don't use it. So
that is why they are not paying attention.
So I'll give you an example. So in the US, the former mayor of New York, Mike Bloomberg, he was mayor for 3 terms, 12 years. For his 12 years that he was in office, he rode the subway to the office. So that tells me that if nothing worked in the city, at least the subway would have worked, because the mayor was on it every single day to the office. Do you understand what I'm saying? So if we have people in government that use the healthcare system, and then they say, oh, you had to wait 3 hours to get an injection. They told me to go get my file somewhere. They told me to do this. Then it would have been sorted out. So yes, there is no buying from the people who should be the actual stakeholders of the system itself, which for me is the saddest thing that we're facing in our country today. We keep hearing this conversation around, oh, there's a ban on people traveling abroad for medical treatments and all of that. We know it is all rhetoric. There are no actions to it. But I believe that it is now that we need to pay attention to the healthcare system of this country. We're dealing with a pandemic. We're dealing with cholera. We've been dealing with some other things as well that haven't come to the fore in the local areas. And I don't see a nation prospering when the nation is not healthy, or when citizens of the nation they are not healthy. Because we cannot keep saying we are broke and expect that bodies that are not healthy would churn out productivity. It doesn't work that way. It just doesn't work that way.
Now, as it stands, SMART, where does it leave us? Because Nigerians are the ones who are at the end of all of this. They are the ones feeling the pinch. Can they hold government to account, begin to hold government to account such that, I mean, something has to be done as quickly as possible?
If you want to hold somebody to an account, that person should even be willing to listen to you. We have a government that is deaf to the people, they are blind to the people, and they are even very arrogant to the people. So even though no matter what you do, it does not move them. So that's why sometimes I am lost. I don't even know what to do, because in the first place, like I've said, if our health, we don't have problem, we don't have need discussing a health issue with a minister. I will tell you, there should be an hospital management team. Like, I'll take an hospital for example. Say Adamant Hospital in London.
Okay.
They don't need the government, because there is an hospital management team that works with the NHIS. They are the one that runs that hospital. They fix the salary, they fix the everything, even everything they do in that place, they fix it. And because in the first place, they are being funded properly by a health insurance that work. Everybody from the age 18 that have a means of livelihood contributes to the health insurance. Now, the same thing when you go, you see, in the first place, I will sympathize with the government, and the reason again why I will not even, because if you're asking them today to vote 1 trillion for the health sector, they don't have such money.
Really?
Yes, because the reason why I say they don't have such money, this is a government that has been borrowing.
Where does that leave the doctors?
This is a government again that has been borrowing to fund the budget that is even under budgeted for in the health sector. So they don't have that.
So where does that leave the doctors?
And now, how do you take care of the doctors? That means the doctors will continue to go on strike day in, day out. The only way out, I have said, is that let us go back.
They have not, over the years, have not been owed their salaries and allowances.
Exactly.
You see, you find out again that we are borrowing again to pay salary. So it's part of the borrowing to pay salary. Are we supposed to be borrowing to pay salary? No. What we are supposed to be doing is that we are supposed to have enough funding. Look, me and you, if we are sick, I'll just go to any health center around me. I can walk in, not even within my locality. I can walk in and give them my NHIS number. They will pull it out from anywhere in the country. They have my history. What is the problem? This is the health challenge. And because it is being funded by that contribution that me and you make. And that contribution, by the time you look at it, let's say, for example, if today we contribute 2,000 naira from your salary, or from my salary, or from my income, I contribute 2,000 naira monthly for my health. That is in the next 12 months, I'm talking about 24,000. If I pay 24,000 for my health this thing, there is likelihood, and at least over 6 million Nigerians pay 24,000 naira. You can see what that multiplies to. Is enough to fund health system in the country. But the government are not doing it. They're not even looking at alternative way of raising fund. So we will still continue to have this problem.
So government needs to look at alternative ways of raising funds.
Yes, to fund the health sector, and that is the health insurance. It must be religiously followed and implemented.
All right.
But I would like to ask, the tens of billions of naira that was gotten for the COVID intervention fund,
Right.
where's the money? Because we're yet to see any tangible improvement or increase or any sort of thing in terms of our health system. So the
Right.
question is, where is that money? Is the National Assembly asking those questions? Is anybody asking those questions? Are the executive or any branch of government, are they giving account of those monies? Because we kept hearing, 10 billion, 20 billion, 30 billion naira. Where is the money? We don't think that any public hospital was upgraded whatsoever. If there is anyone who would like to see it.
Right.
So what did you spend the money on? Building tents or buying face masks? We have to be serious about the business of government if we are to run it like it should be run as a business.
And citizens have to ask the questions,
We have to
because
ask
you
the
are
question.
just asking the question
Yes.
now. And so perhaps when we continue asking this question, putting pressure on government to, ensure that there is transparency with these monies.
And
that you have-
accountability.
And accountability. We would know what was done with the monies. We have to, gentlemen, leave the conversation here for now. Thank you so much, strategy consultant Dikbo Uyewole, as well as social commentator Smart Akpejoye, for your time on the program.
Thank you.
Thank you so much.